And I'll see how far we get. I can't overlap it to Miss Reynolds' time because she'll have a cat. We'll make it up, kids, you know me. So, important, so how long is going to be a prototype agent? I know everybody's on the new templates, they're looking great. The decanate formulation, so that means that these two, fluphenazine and haloperidol, are available as a depot preparation. So once you write that one down, depot, D-E-P-O-T. So that means they're given IM, but yet a different formulation for improved compliance. So the person will get a shot weekly or monthly.
Sorry, can you repeat that?
I know, I'm lost.
Sure, no problem. So just the decanate formulation, so that means it's a depot, so D-E-P-O-T.
Oh, okay.
Compound.
I was waiting for you to spell the rest of it.
I know,
No, that's just it. Yeah, that's just it. So you can give haloperidol. I don't know.
And it was for the first two.
Yeah, those. I mean, I'm sure there's other ones, but we just have to worry about these two. So there's formulation of how they give acutely. Again, on the slide, on the DL we give it IV, but you're supposed to be IM or PO. But these type are given IM as a depot form. So a depot form is just like, what other depot thing? Depo-Provera, just like you do birth control. I want it because I want it long lasting for better compliance. So you think if I'm hearing voices, I'm disorganized, I can't, not bathing, am I gonna, what's the likelihood I'm gonna be compliant with oral meds? Not very likely. If I have it as a depot form, then there's no issue. And it's just like everything. If I'm taking a pill and I start to feel better, the voices go away, what am I gonna do? Stop taking, I don't need this anymore. Well, you still do need it, it's a chronic disorder. But here it's, given, so it's an injection, it's gonna be slow release, so that's why it's a different formulation, that's why the decanate. So we're giving IM into a large muscle, that means what are we using?
The gluteal.
What's that one? Yeah, what's this one back here? Anybody at all? My heart is breaking. My heart's breaking. Yeah, ventrogluteal, perfect. Good one. Could do that. Vastus lateralis.
I heard it like 3 times.
And what's our needle gauge? Just a good needle gauge IM.
18.
Get the hell out of here. We're never gonna
I'm sorry, it's like 22 or 20, 23. No.
Yeah, 21, 23.
Yeah, 21,
22.
23.
All good, all good. How long? See, now we're rolling. Inch and
With
a half,
Z-Track.
inch and a half, yeah. Z-Track, beautiful. Love it, love it.
So long ago.
So anticlinal adverse effects. This might be a tattoo for me. I've said this so many times in my life. Blurred vision, dry eye. Your book added dry eyes. Dry eyes is true, but blurred vision, dry mouth, urinary retention, constipation, photosensitivity. So that means higher chance to get a sunburn. So you're thinking of what? Classic test question 2. When should they avoid? They should use sunscreen, and they should avoid the sun between 10 and 3. And then inhibition of ejaculation, or they could be impotent, not inhibition of impotence, because that's not true. So sexual dysfunction, you just keep it there. So another problem, so those are really more severe with the first generation, these anticholinergic effects. Also more severe are extrapyramidal symptoms. So they're called extrapyramidal because that's just the tract that they affect, extrapyramidal tract. So when you hear EPS, those are let's see, extrapyramidal symptoms. So pseudoparkinsonism. Pseudoparkinsonism is caused by the medication due to the effect it has on the dopamine. So, briefly, in Parkinson's disease, the problem is that you lack dopamine. You have an insufficient amount of dopamine. However that happens. So here it's drug-induced Parkinsonism because remember the drugs work by antagonizing dopamine. So that's why we get these Parkinson-like symptoms. So shuffling gait, I can't do it because I'll fall. I have bad balance already, but they can't take a step. They just shuffle. Their face has no expression, and it's due to the disease. And cogwheel movement. So that means really it shows are really rigid. You try and move them. And it's like old school Barbies. That's how they move. And sorry, gentlemen, you probably haven't played with Barbies, but I don't know how GI Joes work. Action figures work, but Barbies. It's just how it is. Akinesia means slowed movements, and akathisia means that you can have some problems with your trunk mobility. So, unfortunately, how do you counteract this EPS is by giving them another drug, sadly. So an anti-Parkinson's drug commonly is benzotropine, Cogentin. So somebody's on a first generation antipsychotic, they'll be on an anti-Parkinson agent, not because they have Parkinson's disease, but to help decrease these symptoms. So another extrapyramidal symptom is acute dystonia. So ophthalmos is this bad, kind of twisting movement of your neck. So their neck goes back like this. And I'm not saying this to make fun of this is really what happens. The other, common presentation is with oculogyric crisis. So the person.
Repeat the first one again. I'm sorry.
Sure, ophthalmos. So you get this bad flexion of your neck. You can't move it. They can't put their head down. And then they get oculogyric crisis, where your eyes roll back in your head and you can't move them either. So people come in, and this is what they'll be in. Now, oddly, I have never seen anybody with schizophrenia have this. I've seen plenty of, now we do laugh at these people. People used to, not so commonly anymore, it was maybe a 90s thing. They would take drugs off this, buy drugs from people. And they would buy street Valium. Street Valium wasn't Valium, it was what? Ding, 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 Haldol. So people would commonly take Haldol and come in like this to the ER, scared to death. What's happening? You're having acute dystonia. The treatment is IM Benadryl, antihistamine. But still happens sometimes. More common in men than women, younger men than women. So tardive dyskinesia, so these are abnormal facial oral movements. So again, I'm demonstrating not to make light of it. This is really what it is. And I'm sorry we can't do the YouTube thing because it's really terrible pictures. Like things like this. They do that all the time, they can't stop doing it.
Like a twitch or tick, rather?
No, not a tick, it's
just continuously. Oh.
Like really twisting movements of their mouth, and they can't stop and lick smacking. I know it looks, but it's not. It's really horribly sad because they can't stop doing it. And you'll see, and really you don't see it that much anymore because 2019, people on meds like this. But again, it's a shame. I wish you guys were there at the movies because at this Penhurst documentary. Again, back in the day, they would just medicate people, not get the proper therapy. So when you first start having symptoms of tardive dyskinesia, so the facial oral movements is one. extremity and extremity, it should be slash, I'm sorry, trunk movement. So things like, then they'll have like these weird movements and they can't stop them either, like they're just riding music this all the time and they can't stop. And it's drug induced, and even, decreasing the doses, stopping the medication, it doesn't reverse. You're just like that lifelong. So there are plenty of people getting interviewed in the movie who had these terrible things. So, the Ames test, which I had to look up and print out, and of course everything has a scale, I should have known better, but there's a scale for it, not responsible for it. I doubt you'll ever see it again, because I never saw it. I'm living a good life, never twice. But there's a scale to score it. But it's just for our purposes, we need to know if you notice anybody having abnormal facial, oral movements, movements of the trunk or extremities, who's just on first generation antipsychotics, really, they should switch their drug class. Because you don't want them to live their life like this. So, because again of the dopamine blockade, you're gonna have things, hypotension, postural hypotension, and that is what, just that when you switch position, then your blood pressure is gonna go down, your heart rate goes up. So you're gonna tell them, change your position slowly, and then tachycardia. And one that's not, it's not related to the dopamine blockade, but just with antipsychotic medications in general, that I know Ms. Schrager said on Saturday, is prolonging that QT interval. So it's, just part of your cardiac cycle, and, really any patient before they start on, whether it's an antidepressant or psychotropic medication, should get a baseline EKG to make sure they don't already have that. Because some people just have a longer QT interval in general. Hot test question is agranulocytosis. So that's going to really happen more with the second generation antipsychotics, especially clozapine. So agranulocytosis means what? A is without, granulocytes are part of your white blood cells, so decreased white blood cells. So if I have decreased white blood cells, I'm going to have what? Yeah, high risk for infection. So, if you're on clonazepam, you have to get your white blood cell count checked weekly. Okay. These days, clozaril is not used that often anymore because of that, but it's a commonly standardized test question, meaning ATI and CLEX, specialty exams. Cholestatic jaundice is, what's that? Cholestatic is of your gallbladder. Static is just sitting there. So really it's, your bile secretions just get so thick that they just sit there, everything starts to back up and you're gonna have jaundice. So besides having jaundice, what else is gonna be happening? If things aren't going through my liver, what's gonna elevate my blood? Not so much your electrolytes, but the liver function tests, my bilirubin. So, being on, and the cholestatic jaundice is more so with the second generation ones. But if the person did start to have itching, jaundice, dark urine, they should come in and get their labs checked. Which again is another reason why it's so important if their family's involved, because if I have a thought disturbance, I might not be hooked up to tell somebody. And then we already talked about this one too, neuroleptic malignant syndrome. So again, more prevalent with first generation antipsychotics, and typically is with younger male patients. With the hallmark being really high fever, like 103, 104, severe hypertension, tachycardia, would die from it. So you're concerned if they had a temperature elevation, if they start, having like tachycardia, tachypnea, being on the first generation types. And then atypical, and I know we have a lot left, but we're gonna end here. We'll make it up, don't worry. So these really, the newer name or more appropriate name is really second generation antipsychotics. So it used to be, formerly known as atypical. So they block serotonin receptors, all block serotonin receptors. So they're really gonna help reduce the negative symptoms. So negative symptoms were what?
Is it withdrawing?
Yeah, right, when you're withdrawing. So mutism, flat affect, social isolation. So they help but they also do help, they do block the dopamine receptors, just not as much as the first generation ones do. So if they're blocking dopamine receptors, then they're gonna block or they're gonna reduce the positive symptoms too. So that's how they're better than the first generation ones, because they work on positive and negative symptoms. They have less effect on movement, so you're not gonna have all the Parkinson-like things also. They help with glutamate, so remember, glutamate helps with memory and cognition. So still gonna have some of the dry mouth, blurred vision, but not as severe as with the first generation ones. And they can block the dyskinesia, so they can improve the tardive dyskinesia, but we really don't want anybody having tardive symptoms to really stop on whatever medication they're on. This is a big point here too. So other than second generation ones help with positive and negative symptoms, the other bad thing is that weight gain and metabolic problems. So hyperglycemia, that can even lead to diabetes. And it affects prolactin, so you get gynecomastia, so enlarged breast tissue. So male patients gaining weight and getting larger breasts, but then they're getting enlargement of breast tissue too. And women could have leaking from the breast. And also, I want you to write it, and then it can alter one's lipid levels too. So you get increased lipid levels. You think weight gain, increased lipid levels, it's gonna turn into cardiac problems down the line. And here's just a little array of those. So second generation ones, clozapine, clozaril, that's the one that started, because you really have to check that white blood cell count for that one. And you commonly see these, used a lot. And the risperidone decanoate is going to be the one that's in a depot form. And a third generation one is aripiprazole. So that even has a better adverse effect profile. So all those adverse effects are diminished. However, it's crazily expensive. It's much more expensive. So great if you have health insurance and have a family, it can help you out, but not great if you do not. So, so not to worry, kids, I just want to mark right where we are. So, we're right there, it's 561. I will catch up somehow, don't worry. And see you Thursday. We're gonna finish by hooker, by crook. Don't worry.